Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us again. Did you know that there's an important link between dental health and your overall health? But for a lot of folks, about 74 million people, a simple trip to the dentist is impossible. It's impossible because they don't have access to oral health care. Here to talk about the gaps in the oral health care system and what can be done about them is Allison Corcoran. She's Executive Vice President and Chief Marketing Officer at DentaQuest. Welcome to Health Professional Radio.
Thank you very much. I'm happy to be here.
Why is good oral health so important to your overall health?
It's a great question. 90% of medical issues actually have an oral manifestation. And there are strong linkages between your oral health and diabetes, heart disease, and even Alzheimer's. And in fact, a pre-existing oral issue can postpone or cancel major medical procedures, such as heart surgery, chemotherapy, transplants, or joint replacements. But it's an accident of history that oral health is siloed and kept out of far too many public health and policy conversations. And we need to change this. It's time to put the mouth back in the body.
What do you think the reason is for this oral health gap? I mean, people, the first thing you see is a person's face, their teeth. If something's wrong, you know it in your mouth immediately.
Yes, People do know it, but there are, as you said in your lead-in, 74 million Americans who actually don't have access to oral health care, and there are a variety of barriers there. The largest one is cost. Many of those Americans don't have any kind of dental insurance, or they could live in areas where there are not any dentists, or they simply could have a concern or a fear of going to the dentist. So a variety of barriers to getting access to healthcare.
So those barriers seem to mirror the same barriers that exist in healthcare overall for some people. Yes,
it does, but it's actually worse. It's about twice the number of people without access to health insurance. And out of 4 of Americans overall, whether, just across the board, have said that they have experienced one or more barriers to accessing oral health care. Mm-hmm. Cost being the largest, transportation, not getting access to, not being able to go because they're working, not finding a dentist that they feel culturally comfortable with. So there are a variety of issues that do cause this.
In your experience, do you think that people are less concerned about their overall oral health? Is oral health being put on a back burner when it comes to some of the other overwhelming healthcare problems that we hear so much about?
That's really a two-part answer. For people, when we talk to individual folks, more than half of those folks surveyed rate oral health as their top personal health concern. More concerned about their oral health than they are about heart, eye, skin, digestive, or even mental health. Or when you're talking about the system overall, and we're talking about what's happening in overall health, oral health is a little on the back burner. And again, that's simply because years ago, the dental schools and the medical schools grew up as separate entities, and even though the mouth is a critical organ of the body, we're not thinking about it in that way.
So what's the answer? How can this gap, this disparity be addressed?
Well, I think there are 3 things that could really make a big difference in terms of improving access to oral health and improving the overall health of Americans. And based on the survey that we did of all of these different constituents, these are things that everybody agrees on, which is the great news. So there is a problem, but there is also a solution. The number 1 thing is prevention. We just need to get more people connected to preventive oral health care, including regular screenings, cleanings, and education. As I said, oral diseases are almost 100% preventable. The second critical area that can help address this is improving medical-dental collaboration, which means bringing together all types of providers, physicians, dentists, nurses, hygienists, to focus on a patient's overall health, not just the specific area that they feel responsible for. And the third area where we can make a big difference is improving access to care. You can do this both by bringing oral health services into non-traditional settings like schools and community health centers, but we can also improve access by adding dental benefits to Medicare. And in fact, just yesterday, the House of Representatives passed a bill that does include oral health as part of Medicare. And our survey found that 80% of Americans want this coverage in Medicare, and 88% of seniors actually support this. And critically, 7 out of 10 seniors say that they're more likely to support a candidate that is supportive of having oral health available through Medicare. And, as we all know, those seniors both have teeth and they vote. So we think if we can make progress in these three areas, we can start building a stronger system that's critical for the health of our country.
How is DentaQuest involved in helping the progress that's being made in addressing this care gap?
Well, at DentaQuest, we're really working hard to transform this broken system from the inside out. We are part of the current system, but we do see that if we can do prevention, if we can get better medical-dental collaboration, we can add access to care, and if we can change the way care is paid for so that we're focusing on outcomes as opposed to procedures, are all things that will make progress. And we are seeing good progress. Raising awareness, interviews like this is critical. We're seeing more dentists and other oral health providers working with physicians to care for the whole person. We see more interest in different payment models. I think now 40 out of 52 states are at least thinking about value-based care as an approach. Mm-hmm. And as we said just yesterday, we're seeing this very positive momentum on proposals to add coverage to Medicare. So we do feel there's good progress, and if people are interested in learning more about it, we have information available at DentaQuest.com.
Thank you so much, Allison Corcoran, for joining us here on Health Professional Radio this morning.
Thank you. I really appreciate the opportunity to spend some time with you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.